I've been involved with training paramedics and working with EMS for 42 years. And one of the greatest honors I've had was to serve as the paramedic program director for Monroe Community College. And in that time, my last 10 years of that program, we added point of care ultrasound to the curriculum so that the students had ultrasound machines readily available to them for practice, as well as when we were teaching them anatomy and physiology, we would often pull out the ultrasound machine and take a look at the structures that we were learning about. I frequently travel around the country now in my semi-retired years, teaching at various paramedic programs that want to add point-of-care ultrasound philosophies to their curriculum. And I've also been involved in helping many EMS agencies add point-of-care ultrasound to their ambulances and their helicopters. It's interesting to note that back in January of 2009, the National Standard Paramedic Curricula had actually added point-of-care ultrasound to the curriculum way back then. And the authors of this document were very forward-thinking. When you look through this document, you'll see some modern additions to the paramedic curriculum that are listed maybe once or twice. But when you go through this document, you'll see that point-of-care ultrasound is actually listed in it 4 or 5 times, which led me to believe they were really forward-thinking and understood how powerful this technology could be for the pre-hospital providers. Unfortunately, many paramedic programs, even the accredited ones, have glanced over these requirements and standards because the paramedic program instructors simply didn't have the means to teach it. They didn't have the equipment or even the knowledge about how point-of-care ultrasound could be used in an ambulance. So I hope today to inspire some of these paramedic program instructors to seek out training and contact the people that are doing it so that they can add this very valuable technology to their curriculum. Already within the paramedic curriculum is much of the material needed to have a great understanding of point-of-care ultrasound. We teach pretty in-depth anatomy and body planes. We already, as a group of paramedics, view a screen and interpret what we see in terms of electrocardiograms and that sort of thing. And the science and physics preparation, if they don't already get it within their pre-course work, it certainly can be added to the general lectures in the paramedic program so that they can understand the science and physics needed to understand point-of-care ultrasound. And in addition, when you learn about point-of-care ultrasound, it opens up a whole cadre of emergencies that the paramedic could now identify and disease processes that the curriculum normally doesn't cover because it would be nearly impossible to identify these emergencies without ultrasound. So the addition of this technology to the classroom and to the field actually broadens the differential diagnosis and allows the paramedic to hone in on a more accurate diagnosis. You might hear that some people say that this isn't really within the skill set of a paramedic. I disagree. I think, again, in addition to having a lot of anatomy and physiology and the science necessary to understand it, studies show that even 8th graders can technically learn and perform point-of-care ultrasound. But what was even remarkable that the authors found in this study is that these kids went on to teach their classmates how to do it, and the students that were taught by the previous class were as skilled and talented and knowledgeable as the first group. So this is a technology that, while I don't necessarily always believe in the see one, do one, teach one, it's certainly this technology lends itself to this. Educationally, point-of-care ultrasound can really help the paramedic student and the paramedic in the field, because in the classroom, the students were actually able to see real anatomy. They were able to see it in real time. They were able to see the function of this anatomy on classmates and themselves. They could see the high variability within the human body. When you just look at a textbook that's a Gray's book or a Netter book, that really just gives you the idea that the inside of the human body is all the same. But the beauty of looking at 10 different students is that we can see the size relationships and the locations of organs, which I find to be very valuable. being able to see these organs also reinforces to the student that they should learn their anatomy very well, because they're going to be able to look at it in the next 5 minutes. Again, students can appreciate the great variability of human anatomy. I often find even paramedic instructors, if I were to ask them if they could point to my spleen, they would often be off in the wrong location by about 6 inches. But after a little practice with ultrasound and looking at a few spleens, for instance, most paramedics have a general sense of where you would find a spleen. And this is really important in terms of looking for injury and where there is an impact on the body and so forth. And point of care ultrasound is fun. It helps maintain the attention of the students. We're living in an age where these students don't just read books anymore. They watch videos. They like to be involved in the learning experience. And by having hands-on with point of care ultrasound, this ramps up their excitement, and they get to retain the knowledge much longer because of the excitement and the fun that it causes when they're learning it. So one of the interesting things that I found about studying point of care ultrasound is that even if the paramedics practice in a system that doesn't have point of care ultrasound, they will be better providers if the ultrasound training occurs in their original program. And what I mean by this is that, for instance, I learned along the way that when a patient has a classic presentation of kidney stones, for instance, that the differential there could also be a dilated aorta that's now pressing on the ureter and blocking the urine outflow of that kidney, giving the patient the very same symptoms of a kidney stone. And so by knowing that, if I have a patient now that I haven't been able to look at with an ultrasound, and I drop them off to an emergency room, and perhaps the triage nurse wants that patient to go into the waiting room, if the patient has risk factors for a AAA, I would be more inclined to say, we need to have the doc look at this patient quickly to make sure that a AAA doesn't also exist here. So even if people don't have the ultrasound equipment in their ambulance yet, having the knowledge base behind what the internal anatomy is and what it can malfunction to can actually be a real benefit to the providers. Clinically, there's no question being able to see inside the body will allow for more accurate assessments. We've been taught as paramedics that, when someone bleeds into their abdomen, that the abdomen will become very rock hard and will be very painful. And while that's true in about 10 to 20% of the time, it is often completely absent when patients have internal bleeding. And so having the tool to look inside to see if they are bleeding is incredibly powerful and can help us catch patients that don't have these outward signs. Trending of the internal environment of the patient's anatomy is important. For instance, if a patient has an injury that has very slow bleeding, the initial scan may be negative, but if these scans were repeated every 10 or 15 minutes, we would be able to get a sense of the speed at which ongoing bleeding is occurring. And we do that with the 12-lead EKG today. We might do an electrocardiogram on a patient with chest discomfort, and the first one is negative, but then within 10 minutes, we would repeat this and find if anything is cropping up over that time period. There's no question that we would have better skills delivery. Point of care ultrasound is useful in things like starting IVs, making sure that the chest wall is the proper thickness for the needle we're going to use if we're going to do a thoracentesis or any other procedure where we're guiding needles into the body. And then better triage, having a sense that the patient is sicker than we might have thought can help us up triage them to a more appropriate facility. There are new technical challenges for the paramedic. We have patients now that have left ventricular assist devices and total mechanical hearts that are starting to become prevalent in our communities living at homes. And when they have emergencies that crop up, they present some really interesting challenges. For instance, in patients with LVADs who are very dependent on the device, their heart doesn't produce enough of a pulsation to give us the ability to measure their blood pressure. They have more continuous flow in their arteries than pulsatile flow. Point of care ultrasound is excellent for that. You see two students here on the right actually learning how to assess blood pressure by using point of care ultrasound, which will be very accurate in those scenarios. There are new classes of medication being added to the environment and the community all the time. Some of these medications will actually cause spleens to enlarge and spontaneously rupture. And again, without having a tool to pick up these, complications, is just going to leave us flying in the dark as paramedics. And now that there are more specialized treatment centers around, I think if the paramedics have the ability to pick up these finer diagnoses, they're going to get them to the right center more accurately. And today there are patients that are home that are sicker. They have, we have more congestive heart failure patients than ever at home, more patients that have, multiple stents in their heart. And so the acuity of the patients that we see today are sicker than they've ever been. This is kind of an interesting little picture. This shows you some of the fun that some of the paramedics had with point of care ultrasound, but they're also doing some critical thinking here. Here we have a paramedic student who was wondering if his pet tortoise was pregnant, and he knew that ultrasound could answer this question. And so here he is kind of skating the ultrasound probe through into the soft tissue between the opening of the shell, looking for eggs. And this also opens up a conversation with the students. How do we sterilize these probes afterwards to make sure we don't transmit infection between patients to patient? But students were really very forward thinking and involved a lot of critical thinking when it came to ultrasound when it was added to the curriculum. In terms of professional improvement for the paramedic and ET profession, it certainly allows for better communication between healthcare professionals. If a paramedic brings in a patient and tells the doc that there's fluid in Morrison's pouch, that paramedic is perceived to be, much more knowledgeable about the patient's care, and they share a common language in how to, treat and examine patients. Better care would immediately be recognized by other healthcare providers and by the community. And I believe that the paramedics' self-esteem would improve when their accuracy improves. Paramedics are pretty accurate in their ability to make the right call and the right diagnosis, but it's not 100%. And it's always nice to be able to add a technology that will help them increase their sensitivity and specificity when they're trying to figure out what's wrong with the patient. There are lots of interesting future directions for the pre-hospital environment. The equipment now is becoming much more common, more ubiquitous. It is, certainly its quality and durability will improve as somebody looks at the EMS market and realizes that there's 800,000 ambulances in the United States that don't have ultrasound in them. And so whoever captures that market really stands to have a great profit margin. So I encourage companies that are able to make good devices for us to start looking at that market. Connectivity to experts will improve with the 5G networks that are coming. We can stream this data very quickly to the experts, whether they be our emergency room physicians or radiologists or cardiologists, and have immediate feedback and quality assurance. And then, of course, AI and automatic interpretation, artificial intelligence is rapidly improving the ability of these machines to give us accurate and useful measurements that can help us take care of patients. And so I think it's a really exciting future, and one that isn't even listed in my presentation, but is really exciting for me is the prospects of sonolysis. Sonolysis is the use of a standard ultrasound machine to put out ultrasound energy to dissolve blood clots. And in this role, we could use this to dissolve blood clots of myocardial infarction and heart attacks or strokes. And there's emerging evidence that this is very useful and maybe the future in how ambulances take care of heart attacks and strokes. Instead of giving them blood thinners to dissolve these clots, we may be able to use mechanical energy of ultrasound to dissolve them. So very exciting in the future, But if our paramedics aren't already prepared to do ultrasound and understand how it works and understand what to look at, I think it would really slow us down in the delivery of future technologies. I find ultrasound will be an excellent tool in any paramedic classroom and certainly should be added to all EMS agencies that deliver care to emergency patients. It really is the wave of the future.